Hi, we are going to take a look at choosing the right dual special needs plan and LIS cases. When you're enrolling clients into dual special needs plans, the most important part of that is to verify their Medicaid eligibility and what level of Medicaid they do have. So we're going to go over to the quoting screen here. In the middle of the quote screen here in Bedrock, you're going to notice that you have a drop down for the client that receives extra help. Choose the appropriate one. So here we're just going to choose the client receives help from Medicaid. Remember, the extra help program for prescriptions pays the monthly premium, so it will reduce the premium in the quote based off of that eligibility with Medicaid or extra help that you select. We're going to come down and we're going to show S&P plans. And then you can start seeing if providers are in network, just like you would shop any other Medicare Advantage plan. I do want to bring note onto the dual plans here. And every summary of benefits, you will see who can enroll in this plan. United Healthcare, for example, here lists it out, each eligibility level. It is imperative that you make sure that they are eligible for that plan, whether they receive partial Medicaid, are they QMB or FBDE. United Healthcare does a great job of explaining the different levels of Medicaid in their summary of benefits. This is probably the best resource for that. I highly recommend you read it several times and learn it. You can compare plans just like you can with others. For most people with dual plans, it's all about the additional benefits, the dental, vision, and hearing. Obviously, provider being in network is imperative. It can be difficult for them to find new providers that are willing to take new Medicaid and Medicare clients, that dual eligibility. For clients that receive only extra help, not Medicaid benefits, we have another case to look at because they are responsible for their cost at the doctors and hospitals. So we're going to turn off the S&P filter here. But again, the extra help pays the monthly premium based off their eligibility. So a lot of times you can use that extra help program to lower the monthly premium of a plan, and then they can get into a plan that may have better additional benefits, more dental or vision. So leverage that extra help money to lower their overall cost. A good example for that here on this area will be this United Healthcare Medicare Advantage Choice Plan 3 plan. Normally, this plan has a monthly premium of $21. With the extra help, they will pay $19 of that, and $2 is remaining as considered medical plan premium. But this plan will have lower copays and more benefits like the dental, vision, and hearing. So it's all about maximizing the client's options, utilizing those programs to their fullest extent for each of your clients.